Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Rural hospitals are already under incredible pressure to maintain razor-thin margins while keeping services open and serving a disproportionate share of uninsured patients. The workforce shortages, reimbursement restrictions, and coverage eligibility changes have only further burdened operations and our finances for hospitals across rural America. In an age when adequately caring for patients in rural communities is growing more difficult by the day, an influx of expensive, untested artificial intelligence is certainly not the answer. Yet this is what Health Secretary RFK Jr. and the Centers for Medicare and Medicaid Services Administrator, Oz, are proposing. Their plan involves AI-powered robots taking over nursing duties in rural hospitals. The most obvious problem with this plan is that these AI robots don't actually exist. The leaders of our industry continue to promote non-existent technology with no concern for the price tag and no understanding of what rural hospitals are truly facing. Some states are optimistic about the possibility of federally funded technology, but most, including those with high death rates among their rural populations, are expressing great frustration with the impossibility of making up for the dire Medicaid and Medicare cuts rapidly approaching. On to the damage report. Last month, CMS proposed a rule to make changes to the Affordable Care Act marketplaces, specifically expanding high-deductible plans and permitting policies with no provider networks to join the exchange. Network adequacy rules would be more relaxed under this rule, and states would be responsible for all of the oversight. Now, hospitals and physician groups are speaking up to caution the industry on the financial strain, increase in hospitalizations, uninsured rates, and other damages this rule would cause. The communications to CMS have warned of an increase in medical debt and decrease in key consumer protections, leaving many currently protected enrollees without adequate access to their care. The dangers of this rule come from a supposedly innocent premise that it will make healthcare more affordable and strengthen program integrity in the exchange. In reality, handing CMS the reins for currently stabilized marketplace policy would only restrict access to care even more. Oftentimes, the eligibility requirements for plans are established because of the limitations that pre-deductible coverage requires. Thank you to the American Medical Association, the National Rural Health Association, and the American Hospital Association for leading the charge to defend access to care across our nation. And now for today's success story. Rural communities often lack emergency mental health services, leading to unnecessary hospitalization or confinement in jail when a crisis escalates to law enforcement getting involved. Virtual Crisis Care is a program in South Dakota and Wyoming that helps law enforcement connect people experiencing a mental health crisis to clinicians via telehealth. Deputies and police officers can access real-time clinical guidance to make informed decisions that will better serve a patient's need and mitigate the risk they may pose to themselves or others. The county sheriffs reported an improvement in de-escalation during mental health crisis calls, putting both patients and law enforcement officers in a better position to navigate these situations and make clinically guided decisions. The program also provides follow-up care for residents by partnering with local mental health providers. Since law enforcement began implementing virtual crisis care, 86% of people who access the program could remain at home rather than being jailed or hospitalized unnecessarily. Programs like Virtual Crisis Care emphasize the importance of telehealth access for rural communities where specialty services can be severely limited. Thank you to our sources for this episode: the Detroit News, Washington Post, Modern Healthcare, CMS, and the Daily Yonder.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire. Our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.